We have conducted a phase 2 trial with carfilzomib, dexamethasone, pomalidomide, and elotuzumab in high-risk multiple myeloma, defined by patients failing proteasome inhibitors and patients failing lenalidomide, having renal failure, plasma cell leukemia, or high-risk cytogenetics. This high-risk population, despite that, with fixed doses of these drugs, have had good responses and good tolerability. So we've even seen complete responses in the first dozen or so patients treated. The safety signal has been good, except we did have one patient with cardiac events that related perhaps to the carfilzomib, which is well recognized to do that occasionally in myeloma. We are encouraged by the early results and hope to further explore this combination in more trials and more patients.